Hey class, we're going to be talking about arousal disorders. We are on week 2. And this is the thing. When we are coming into therapy and we're meeting new clients and situations are brought up, usually it takes a little bit of time for someone to be honest about what they're experiencing. Occasionally you'll have a client off the cuff be like, look, this is my issue. But a lot of times, especially when it comes to sexual dysfunction, clients tend to be more private. It's kind of embarrassing. It can be awkward. Like I said, all of us in our experiences with our family members, parents, guardians, whatever, whoever raised us, had different levels of communication when it came about sex and sexual elements, puberty, how sex works, what to expect, all those kinds of things. Like, for some of you, maybe you really had parents that like dove into that. For others of you, you didn't at all. And for a lot of our clients, like they don't experience that from any sort of parent, or they didn't have that experience. And as a result, there can be sometimes a lot of shame. There can be just embarrassment. Like, I should know this. I'm a grown adult and I don't know this. I'll be in a room with fully grown adults and we're talking about something and they giggle or laugh, especially in couple sessions when we're talking about intimacy and they're embarrassed to say like something about oral sex or whatever, And as a clinician, our role is to be obviously very calm, very neutral. I joke a lot with them. I make it light. But still, we have to be willing to ask the hard questions and try to get to the answers and normalize things for clients. I think that really helps them to feel like, oh, this is normal. Oh yeah, I've talked to many people about this. This is very normal. This is something people experience, those kinds of things. Because this allows them to not feel so, on edge or things of that nature. So when it comes to sexual dysfunction, usually it comes up once maybe intimacy is brought up, once you've gotten to know them a little bit more, and then they start to share what some of the issues are. Maybe there's a wife coming in, especially as we're talking about female sexual arousal disorder. Maybe a wife comes in and then she starts talking about intimacy and how it's so hard for her and how she doesn't enjoy it, or how her husband complains that they're not having it enough, or she has a low sex drive. And so this is when we have to start putting on our thinking brains and being like, I wonder why this is occurring. And so that's when we need to start getting some history. We need to get history, like medical information, like has she been to a doctor? Has she recently had a baby? Where is she at in regards to menopause? And does she notice changes in her body regarding hormonal shifts, like closer to her period versus away from her period, things of that nature? Because our bodies play a very intricate role in like how we experience arousal. And so sometimes somebody could have a health issue going on, and as a result of the health issue, they're now having some issues with sexual dysfunction. Now, we are not doctors. We cannot diagnose. We are not, we don't have a MD. So we always refer to a physical. I would talk to your gynecologist. I would talk to your doctor about what you're experiencing to see if there's something else going on, right? Because that is a very common thing to have going on. We could have people who have had certain changes or certain shifts in their physical bodies that are resulting in sexual dysfunction. A lot of great questions to ask are, has this been an always thing? Have you noticed this ever since you started having intercourse? Is this something that's developed as you've aged? Is this developed maybe due to a situation that's occurred? Meaning, sometimes partners will start having sexual arousal issues like once like there's been a major event, like maybe there was an affair, maybe something traumatic happened to them. Maybe they remembered something that happened to them as a child. There can be things that happened to somebody as well, an experience that now causes sexual dysfunction. We are very holistically created, mind, body, soul. And so I think when our mind is somewhere due to a traumatic event or a situation that occurs, our bodies then react and respond. For some, not everybody, but for some. And so as a result of that, that's where we can start to kind of connect those dots for clients. A lot of times clients don't connect those dots for themselves. And so we can help guide them in kind of connecting those dots to figure out what needs to happen in order to have a different outcome. Because of course, people want to have pleasurable intercourse. Like they want to have sexual, arousal while having intercourse. And of course, a partner um, usually wants to have a partner who has an orgasm. And if you're having an arousal disorder, you're not able to have that outcome. And so, again, it can be very embarrassing. People pretend or to fake it. And that's not helpful, and that's dishonest. And then it's like, when is it really a true experience versus a not true experience? I think we watched, or if you've watched, I mean, it's up to you if you ever want to watch it, but there's that movie, it's old, When Harry Met Sally, and there's that incident in the restaurant where she's taking a bite of the sandwich and she totally fakes an orgasm to show the men, like, this is what women do. And then someone in the restaurant goes, I want what she's having. But that kind of practice is not good. It's not helpful. And for the female in the situation, she's still not getting the outcome she wants. Now, if there is sexual abuse in a person's history, oftentimes this will cause some level of either hypersexuality or hyposexuality. And if a person hasn't talked to their partner about an experience, then there's a lack of communication and a misunderstanding. And so a partner could be doing something while in an intimate situation that could be very triggering. And this is why communication in sex is so important. It's like sex 101. If you have a hard time making boundaries or saying yes or saying no to things that are not sex related, you're going to have a hard time saying yes or no to things in a sexual situation, because you want to please. And as a result of wanting to please, like, you're not being honest with what you're feeling. And so oftentimes the couples will come into situations where maybe there's a position they don't like, but they've never said anything and they've just been doing it forever. Or there's this situation where, they really like when their partner does this, but they don't ever say anything. And so not talking about the sex is going to not help you to have better sex. And so I always talk to couples about, you got to talk about it. Like, I know it's weird, I know it's uncomfortable, but like, we have no problem like wanting to do it, right? But we have to be willing to be like, this feels good, this doesn't feel good. It's not personal, it's just preference, right? And so if I can better understand your preferences, then I'm going to better understand how to meet certain goals, right? And so that's important. That's important for us to understand about each other. That's important for couples to understand about one another. It's just one of those basics that's really necessary and important. So when a woman is experiencing an orgasm problem, again, we always want to go back to medical. What's going on? Do they understand their clitoris? Do they understand how their body works? A lot of times with women, they do not understand how their body works. And so as a result of not really understanding, maybe they don't know how to achieve an orgasm. Also, depending on partners and their experience, they may not understand a woman's body that well either. And so that's why I think knowledge is power. And for us as clinicians to assign, books or things for clients to read that are appropriate. There's a book called Intended for Pleasure. I know back in the day with CBU, we did the book A Gift to Sex. So nothing that's like pornographic or whatever. I mean, again, God created sex. He created it for our good. But like, again, it's just a lack of understanding. I think oftentimes in especially Christian communities or very conservative communities, sex is bad, bad, bad until it's like you're married and now it's good. And that's very confusing, because it's not that sex is bad. It's the idea of the timing of intercourse. And so it's all about holiness. It's about this is what's best for you, because we want you to have a pleasurable experience, right? And I think when we look at it in such a negative connotation, the exploration piece and all those things while married is just, again, very confusing. And so that's why it's so important to have good conversations with our young people. It's important to have good conversations when you're doing premarital counseling about expectations and what you think it's going to be like and all those things, because that's where people tend to start having issues, because they have so many unmet needs or wants that aren't communicated. And then there's resentment and frustration and disappointment. And this is not an area in your marriage that you want to feel disappointed by, right? And again, that's because people don't usually talk about it. And so when it comes to orgasm problems, sometimes it can be due to, again, life changes, season of life changes. As women age and they get into menopause, there's vaginal dryness, our bodies are shifting. And as a result of that, that can cause some issues. And again, if you don't know those things, knowledge is power. It's about education. And so a lot of what you'll do as a clinician is a lot of psychoeducation. You're going to educate your clients on things that they don't know, that they don't understand, so that they can better equip themselves. And so you might challenge them. Hey, this is what I know about this. Maybe you should talk to a doctor. Or hey, maybe you should try reading this article, or chatting with some other of your peers that are going through the same season of life with you, and see if they're experiencing the same thing, kind of normalizing it for them. Because oftentimes, again, when we are experiencing something that we're kind of ashamed or embarrassed of, we don't talk to anybody about it. There can also be issues with depression, anxiety. If you're depressed, usually you're hyposexual. There's not a huge sex drive. So maybe it's someone seeking out medication, navigating why they're feeling depressed, all those kinds of things. It's hard to get in the mood when you're not feeling good about yourself and things of that nature. And like I mentioned, cultural issues, and a lack of education on how to achieve an orgasm, the need for foreplay, things of that nature. If we're just thinking penetration is all that needs to happen, it's usually not. When I was in this course ages ago, I think my professor talked about, they had a picture and there was like a microwave, and then it was like the cockpit of an airplane, and it was like men are like microwaves and women are like cockpits, and there's like gauges and notches and all the things like levers, and this is the thing, like, and I'm not trying to be totally stereotypical, but usually men, like, they can get going pretty quickly. It doesn't matter if there's an emotional disconnect or anything. They're like, let's do it, and for women, it's like, depending on how you started the day will depend what happens later in the evening, right? And for women, an emotional connection is really important, to have an intimate connection. Maybe not all women, but some. And so being able to figure out, like, is the reason you're not achieving what you want in an intimate physical relationship, is it due to not having an intimate emotional relationship? That might be really hard for someone to understand, but that could be why they're not achieving the outcome that they're wanting, is because there's not that emotional intimacy. And so maybe part of your role is helping someone work towards achieving that emotional intimacy with their partner, so they can achieve the physical intimacy with their partner. Also, if we don't have emotional intimacy, that's where we have discomfort in talking about hard things, right? Like, because if I'm emotionally intimate with my partner, I can have hard conversations, maybe awkward conversations or embarrassing conversations, because I have a closeness with them. If I don't have that closeness with them, it's really hard to have those kind of harder conversations, right? And so this is something that we will do a lot in couples therapy, is talk about that emotional intimacy piece. Couples can be really great at logistics and like figuring out where everybody needs to go and when, and who's making dinner, and who's taking kids to school and all those kinds of things, but we have a hard time getting down to that deeper level, right? And sometimes when we start having a sexual dysfunction, that's like the iceberg, right? It's like the tip of the iceberg. Like, that's the symptom that we're seeing to a much deeper issue. That what sunk the Titanic wasn't the little bit of the iceberg at the top, it was all the things underneath. And so that's what we have to get to in therapy, is all the layers, the peeling back of the onion, to see what's really going on here that is causing this problem. Again, asking those great historical questions, like, has this always been happening? How often does it happen? When have you had a different experience? All those kinds of, can you achieve one on your own? All those things. Or when you're in foreplay, can it happen? But when there's penetration, you can? Or is it in these it's asking those what could feel like very awkward and intimate questions. But what are we doing in therapy unless we're asking those questions, right? Especially if it's causing a problem and they're bringing it up. We have permission to ask those questions, especially when someone is inviting us in to their difficult situation. Okay. So I just wanted to kind of talk through that. there in your text, you have great reading. This book is really great on going into detail on things about it. Your DSM, these are diagnoses in your DSM, so you will also see them in your DSM-5. That is like the Bible of psychology. That is what we use to diagnose, bill insurance, all those things. So please get familiar with that if you're not familiar with that already, but that will be used and needed as you go through this program and as you go on with clients in your future. But again, get ready to ask those questions. If any of you are in traineeships and you're starting to work with people, you're going to come across these situations. So get ready, because you got to be prepared to not, even if you feel awkward on the inside, and I'm not saying you won't feel awkward, even if you feel awkward on the inside, you got to have your game face on so you don't show that awkwardness on the outside. I hope you all have a great week. Take care.